The Kenya AIDS NGOs Consortium, KANCO, was established in 1990 as a national membership network of non-governmental organizations, community-based organizations, faith-based organizations, private sector actors, research and learning institutions involved in or that have interest in HIV, AIDS, TB activities, and other public health care services.
KANCO has been the platform that has brought together non-governmental organizations and private sector organizations to be the depository of knowledge which we need in the fight against AIDS.
The organization also provides for associate membership that includes individuals and international non-governmental organization partners. KANCO has a membership of over 1,000 organizations and numerous individuals that are networking, collaborating, and are bound together by a common vision of public health issues that are of importance in Kenya. KANCO has evolved to become a premier agency for sensitizing, mobilizing, and promoting collaboration among civil society organizations. In 2009, KANCO was accredited as a linking organization for the International HIV and AIDS Alliance. The alliance works globally to support communities to reduce the spread of HIV and to meet the challenges of AIDS and related health issues. KANCO supports joint action on HIV, AIDS, TB, malaria at a community level and commits to developing mechanisms to help CSOs work together to achieve shared goals. KANCO's goal is to provide leadership among CSOs in contributing towards realization of universal access targets in Kenya. KANCO's vision is to have a healthy Kenyan people with secure and sustainable access to HIV, TB, and other public healthcare services. KANCO's mission is to provide leadership, promote collaboration, and enhance capacity among civil society organizations and other stakeholders responding to HIV, TB, and other public healthcare services. The origins of KANCO can be traced to a group of 7 health and development NGOs and religious organizations that began meeting in 1989 to discuss the growing impact that HIV/AIDS was having on development in Kenya. KANCO's founding members include Action Aid, African Medical Research Foundation, Christian Health Association of Kenya, Family Planning Association of Kenya, Kenya Catholic Secretariat, Kenya Red Cross, Norwegian Church Aid. Intention to establish a formal network of civil society organizations was put forth in 1990. KANCO began its operations in 1991 when its first advisory board was elected and was officially registered as a non-profit organization with the government of Kenya in 1997. In the early years of its operations, KANCO concentrated most of its efforts in responding to the manifest needs of its members. This included, but was limited to, high-quality HIV and AIDS-related information, education, and communication materials, as well as technical documents on policy and/or program issues.
KANCO has the major responsibility of lobbying for commitment from the government in implementing policies that support local-level organizations in addressing community needs.
It's until around 1995-96 when civil society organizations realized that there was a need for a policy framework that would be used or that would guide the government and other stakeholders on how we're going to respond to HIV as a country. And KANCO played a very major role in mobilizing other civil society organizations that had an interest in HIV response, and they lobbied the government and they lobbied other players, even from the international community to ensure that there was a legal framework or policy framework, and that's how they worked with players from the legal fraternity to put together the sessional paper number 4.
The sessional paper number 4 of 1997 was adopted by the Cabinet and Parliament and is, effectively, Kenya's national policy on HIV and AIDS. In addition to information sharing, policy development, and advocacy, a major emphasis on KANCO's work has been in the area of training. Every year since its inception, KANCO has promoted training opportunities to members and has organized numerous workshops. KANCO is governed by a board composed of a chairperson, vice chairperson, secretary, treasurer, youth representative, representative of persons living with HIV, representative persons with disability, and 3 members. The governance board is elected regularly according to the Constitution and provides feedback to KANCO members through quarterly and annual meetings. The governance board members include the following: 4 individuals from the NGO Consortium members elected at the AGM, the executive director, co-opted advisory members. These are representative from communities living with HIV and AIDS and TB, representation of PWDs, representation of youth, a representative of CBO. The consortium members elect the chairman, vice chairman, treasurer, and 1 member at the annual general meeting. The secretary serves as ex-official member of the board. A third of the advisory board members elected are either women or men. KANCO's strategic areas of focus for the period 2010 to 2014 is on 3 main areas: community system strengthening, improving policy for HIV, AIDS, and TB, institutional system strengthening. KANCO has been a pioneer and a champion in a number of areas. KANCO was the first organization of its kind to pioneer the establishment of national resource centers on HIV and AIDS at its offices in 1993. KANCO championed the concept of constituency AIDS control committees in 2000. It was at a workshop sponsored by KANCO in 1999 that the then President of Kenya, Honorable Daniel Arap Moi, declared HIV and AIDS a national disaster. KANCO also initiated and piloted the Prevention of Mother-to-Child Transmission Project and child-centered approaches to HIV/AIDS in Kenya. In 2006, KANCO became the first organization to initiate advocacy for the declaration of TB as an emergency in Kenya. KANCO was a part of a committee that developed the TB in the workplace policy, the first one ever in Kenya. KANCO is renowned for working with key populations, especially sex workers, men having sex with men, and injecting drug users in Kenya, among other accomplishments. KANCO's other achievements include influencing the content of national HIV and AIDS policy, winning acceptance of a role for civil society organizations in policy development, recognition of KANCO resource centers as Kenya HIV and AIDS information focal points in the country, contribution to the coordination of HIV and AIDS activities among CSOs working in HIV, AIDS, and TB in Kenya, successful documentation and dissemination of several publications targeting community interventions.
In its formative years, KANCO has done commendably well.
The first award we got was the one done by the Commonwealth, and among ourselves was the head of state of Uganda and the Agro-American company of South Africa. I felt very proud sitting next to the head of state receiving this. The second award is how we do our business. We also got one award where we were recognized among key business people because of our business and management of the way we do our business. This was awarded in Geneva. We have also been awarded externally by the African region as one of the best civil society movements responding to HIV by Africa. And to conclude, we are part of the national response. So when the National Council is awarded the best non-state STAD, they are part and parcel of that group. And that has come in the last 5 years or so, the head of state have been awarding National Council, and we are very proud to be part of that group.
One of the key things that KANCO has to start doing now is to ensure that as the country goes to more devolved government, KANCO should be part of it.
Across the board, we want to see a capacitated institutions to be able to respond to the epidemic, more so from the civil society perspective.
For more information on KANCO, you may visit our website www.kanco.org or get in touch with our national or regional offices on the addresses on your screen. KANCO, supporting community action on HIV, AIDS, and TB.